that we work very closely with a lot of state agencies as well, like the Board of Elections, like the Secretary of State's office, to make sure that things are being done that are not only sensitive to, but promote awareness and access for people with disabilities in the state.
Alyssa, can you add to that with some of the other committees that we may be missing right now?
Yeah, so Rory, I think, hit on all of our permanent committees, but we will have kind of one-off subcommittees here and there, like, Tina and Rory, I think you're both part of the one planning for the 30th anniversary of the Americans with Disabilities Act, which we just celebrated in July, and that was put together to really come up with the events, identify different partnerships that we wanted to have. We usually have a subcommittee for our public forums every year, where they'll come in and they'll go through the testimony, really break it down and say, these are the problem areas, these are the consistent issues that we're having raised across the state, and that'll then be put in front of the legislation committee. So they don't have to, go through all of that on top of all of the legislation that they're already going through at each meeting. When we celebrated the 25th anniversary, we had a subcommittee for that. So, here and there, as different things will come up, we'll say, okay, we need a small targeted group of people that's going to come in and work on this.
There's also one for employment, correct?
Yes. Oh, sorry. I thought that Rory had said that one. Yeah, there is an employment committee, and they do a lot of work around education and outreach, working with different employers, really showing them the benefit of hiring employees that have disabilities.
Yeah. So it's a lot of great committees and stuff that people could get involved and be part of, the political legislation part, and actually really helping people out in the process. That's what I like so much about the commission, is we can do so much good, and it's regular everyday people that can do so much good. The Home Modification Act, Rhode Island is in the forefront. We're probably one of the only states that have the Home Modification Act. Could you tell us a little bit about that bill, Rory, and what it does for the state?
Well, what it does for the state, but more importantly, what it does for people with disabilities, it allows them to stay in their homes longer, to make modifications to a home, whether it's a ramp, whether it's a threshold barrier that might need to be removed or replaced, or a bathroom that might need to become more accessible. It allows the homeowner to make those adaptations in their home to preserve that placement, if you will, either for them or for a loved one. Sometimes it's for an older or an elderly parent. Sometimes it's for a child with a disability. And we do grants of up to, is it $4,000 or $5,000 now, Alyssa? I go back and forth on what the $4,000 now. That allows, it's not a lot of money, but sometimes it's enough really to make a big difference for a person so they can keep an individual at home. Money is put into it through the state, and we're always advocating for more money to be put into it in order to keep people the opportunity to be home. And, the construction, it's required that you come up with a plan ahead of time, that we sign off on the plans so we know that the modifications are not only credible, but they're done by a reputable builder, that it meets the ADA codes. So there's a lot of oversight in it. It's not just, something you just go in and you pick it up. So there's a lot of due diligence on the part of the homeowner or the person who's going to be doing the modification for you.
Why is it so important, Alyssa, that Rhode Island leads in this Home Modification Act? Because I know it's so invaluable for people, for staying in their homes and, to take advantage of this. But tell us more about the program and why it's so important that Rhode Island leads in this.
Well, Rhode Island's an old New England state, so we have a lot of old New England buildings. There's a lot of buildings that have stairs, that have narrow hallways, that have narrow doorways, that have bathrooms that you couldn't get a wheelchair into, let alone get a wheelchair into and turn around and have the turning radius needed. So for us, it was, like Rory said, really helping people to stay in their homes, to age in place, to not get to a point and say, okay, I have to leave my home that I've been in for the last 20, 30, 40 years because it's just not accessible and I don't have the money to make it accessible. We really, we have an income cap, And it's a little higher than it typically is because we want to work with people that are probably not going to qualify for another program. They're not going to qualify for the Independent Living Center program, to have this provided through insurance, through Medicare or Medicaid. They're not a veteran. They're not going to get this provided through the VA. But spending $4, $5, $6, $7 grand out of pocket is going to be just a little bit too much. So it's really to help people in that kind of mid-range group. And we are the only state that has it set up like a grant program versus a tax credit, where Virginia, I think, is the first state that did a home modification program in general, but theirs is set up as a tax credit. So you have to be able to dish that money out and then wait to the next tax year so that way you can claim it. Whereas for us, it's 6 to 8 weeks within the time of you completing your project and submitting that post retrofit paperwork to us. And we really try to make the process go as smoothly as possible, to go as quickly as possible, to revise the regulations. Each year we've gone back and we've looked at them and said, okay, what can we learn from the last year? Are there home modifications that should be added that we maybe didn't think of? Are there exemptions that we didn't think of? We put some in place saying that if the project was done before you submitted an application, but it was so that you could come home from a nursing home, come home from a hospital, then we could have a letter from them and work with them to grant you an exemption. So we really want to make this a program that works for people as much as possible.
It is an absolutely fabulous program, and I know there are so many people that are taking care of it. And people now, with the COVID pandemic, that's this global pandemic that we're dealing with, it's more important now than ever that people are not in nursing homes and they're not in congruent settings. Like Rory, you work for a group home setting. Tell us how COVID has affected that, to see why the home modification is so important.
Well, I work for AccessPoint. We have a number of group homes within the community, as do a lot of agencies, and I think any congregate care setting, any group home, they've been hit hard by COVID because we rely on a lot of different staff coming in and out of the facility to provide supports to people who need them. And we've seen over even the last couple of weeks a real uptick in the amount of COVID positive cases within our staff and within the individuals we support. So it's requiring more and more of kind of kind of like a lockdown too. Their visitations for the upcoming Thanksgiving holiday have been suspended in an abundance of caution to make sure people are safe. And I think when we look at some of our older folks, the need for safe housing is so critical. But then I also we have a lot of elderly parents who are caring for adult children with disabilities, and a home modification program could make it easier for them to maintain taking care of their sons and daughters in their homes. And at a point when the older parent can't provide those services to their adult children, the home can become just as successful for their adult children to remain living there with supports in place too. So people don't have to kind of get ripped out of their home if something were to happen to the older caregiver who might be providing services to them. I think the way you saw how nursing homes, other settings were hit hard by COVID, a lot of it had to do with the amount of support that's required and the staffing that's required. We're facing an incredible crisis in staffing shortages, trying to find people to do the work, to minimize kind of that cross staffing where you see staff going into multiple homes, and that provides a risk for spreading COVID. So we're advocating a lot on making sure that hourly wages and safety and those things are brought to bear to this legislative session, to know that we need to protect folks. And in order to do that, we need to ramp up, to use your phrase, we need to ramp up how we provide services to our folks and how we take care of the people who are providing those services to our people. And that means the direct support professionals who are in there every day. And I have to give a huge shout out to our direct support professionals. They have showed up every single day since this pandemic started. We've not had a sick out. We've had people show up and continue working in full PPE every single day of this crisis. And you can't put a price on that. And people are working and working diligently to make sure people are safe. And quite
It's,
frankly, it's about
yeah.
time they recognize that. The state
And
recognized
I truly
the
believe,
contribution of
yeah,
direct subordinates.
they are the real heroes. They honestly are the real heroes right now, you know, taking care of those, you know, that need the help and part of this pandemic. It's so scary out there. Being a pandemic, Alyssa, I'm going to put this one towards you. Tell everybody how the commission is still making sure that ADA compliance is still working with the COVID restrictions that are going out there.
So Denise Wilhelm is our Title 2 and 3 ADA coordinator, and I would have to give her a huge shout out because she's just been working tirelessly for months now, working with the Department of Business Regulations and making sure as these regulations are coming out, the ADA is being taken into account in all of them, that we're not putting restrictions and requirements in place that are in direct conflict with the requirements of the ADA. We're also just trying to do education in general. We had a webinar coming out. We put it together with the help of the Commission for the Deaf and Hard of Hearing, and it's talking about employment requirements during the age of COVID and what you can and you cannot ask employees, what it means to ask for a reasonable accommodation, what it means to have your health information for it to be private. And just really making sure that people know this is what the law is, and that you want to be safe and you want to put whatever precautions you need to in place, but you don't want to violate people's rights in order to do that. And working with, like I said, the Commission for the Deaf and Hard of Hearing, especially for ensuring that there's effective communication right now, especially for people that rely on lip reading. And with everyone wearing a mask, it obviously makes it very difficult to see somebody's lips through their mask. So making sure that doctors' offices, that stores, they have some kind of accommodation in place, whether it's surgical grade plastic clear face mask, whether it's having pre-planned answers to commonly asked questions that they can just point to. Just making sure that people with disabilities aren't being forgotten in all of this and aren't being left behind.
Yeah. It's so true. Like even when they had the outdoor dining and they had the big initiative of doing everything outdoors, well, where did most restaurants want to put the extra tables but in the handicap parking spots? Because let's face it, they're the biggest amount of spaces closest to the door where they could just. So that's okay because it is a global pandemic as long as you accommodate making other parking spots throughout the parking lot. And it was just a matter of working with the restaurants or working with the businesses to make sure, okay, if you're going to use this because of the global pandemic and you're using this as an emergency section, you still need to have accommodations for parking for people with disabilities so they can still come and enjoy your establishment in the middle of a pandemic. It is so good. Rory, can you tell us some of the highlights of the commission or some of the really great points that the commission has done recently that would stand out to you?
I think there's a lot of them, both on a small scale and a big scale. And I think of things that just allow people to be more in their community. I think of the floating ramps or the docks, so people who are boaters can wheel down to a dock and then be able to get in and out of their boats safely. I think of the wheelchair beach, the sand chairs, for the wheelchair sand beach chairs for the beach. So a person who uses a wheelchair can roll out into the ocean just like everyone else in a specialized chair. I mean, things like those. Closed captioning for political ads for the deaf and hard of hearing community was a big one a couple of years ago. I think every opportunity we have to meet the big needs and the little needs of people is something that the commission does do and continues to do. So they need some very spectacular things for people with disabilities. I think of modifications they've made at the Veterans Home in Bristol and really championing, making sure that those doors are made much more user friendly for the people who are there. Making sure the Board of Elections is accessible to all people. Everything is about making sure the citizens of Rhode Island have full and complete access to their community.
Alyssa, can you think of any that stand out to you?
I think for me, I think of more of the day-to-day kind of things, some of the smaller things where, someone calls and they say, mom's coming home, I don't have the money to put a ramp in, what do I do? And okay, can you go through our home modification program? Have you heard about the Center for Independent Living? Does your city or town have a community development block grant? Just being able to give them resources that when you're in that situation and your whole world is changing, that you just don't have the bandwidth to say, okay, let me go in and go to Google and thoroughly research all of this, and being able to provide that information. Sometimes it's, saying, okay, I'm going to take your complaint with this restaurant or this store, and I'm going to call the manager, I'm going to call the owner, and we're going to get it resolved. And really helping to give a voice to someone who maybe feels that they didn't have one, who figure when they call us, oh, I'm going to get the brush off and nothing's going to happen. I think of, all of the letters and notes I've accumulated over the years that I pin up for people saying thank you. And it's for something that, might seem so small, but it really makes a difference in that person's life, and that builds and builds and builds. And then I think about the businesses and the government agencies that I've worked with over the years, where I've went to them and said, okay, here is an issue that's being had, and the ones that have responded in such a positive manner and really made an effort to change how they're doing things and the cumulative effect of that. I think we had a library that I dealt with a couple of years ago, and there was a policy that was not great, and they changed it. And just the way they've reacted to it ever since then is every single time they're going to put a new policy in place, they send it over and say, can you just read this over? I want to make sure that it's what it's supposed to be. And when they were going through and doing the reopening guidelines, to reach out and say, can you make sure that all of these guidelines are going to be accessible and we're not discriminating in any way? And that spread through all of the libraries in the state because of this one organization. So I think it's those little things that just build up.
Yeah, it is so great. And what we really want people to know is that the commission isn't out to hurt anybody, isn't out to hurt any businesses, or we're not looking to penalize you in any way, shape, or form. We want to work with you. You're not inaccessible maliciously. You may not know of certain rules or certain ways to become accessible. I want to take a minute and say hello, Bob. Glad you could join us tonight. Why don't you introduce yourself and tell everybody a little bit about you? Bob, I don't know if you're on mute.
Cooper,
There you are.
the Executive Secretary at the Commission. Sorry I couldn't join you earlier, but I was monitoring the House Finance
Committee.
So, well, great to have you with us now. We were just talking about thinking of some of the highlights that the commission has done over the last couple of years. Is there any highlight that stands out to you that you want to mention?
I can think of two. One is the fight to ensure that mental health services paid by a health insurance company are at least as good as medical or physical health coverage. That was a problem. And the other I'd say is making sure that we bought equipment so people who were blind could go independently and in secret. Everybody not have to have two officials come over and fill out their ballot for them.
Yeah, those are great. Those are a great idea. One of the other commissions that I really find intriguing, Rory, I'm going to let you take this one, is the hearing board. It's somebody that we don't do often, but tell everybody a little bit about what the hearing board is and what it does.
Well, essentially, if a person has a complaint or feels that their rights in some way have been violated, they can bring it to the commission, who would try to mediate or to negotiate a better outcome before it goes to whatever would be the next step. And that's probably as broad a kind of a description as I can give. But the goal is to mediate, is to get better outcomes without it becoming litigious or cantankerous, and it hopefully creates a dialogue or a better conversation there between people as well, so people understand each other's point of view and why things need to be amended or fixed or adapted.
Yeah, that's great. Tell us a little bit about, Alyssa, I'm going to let you take this one. Tell us a little bit about the different members of the committee and how they all make up a great committee.
Are we talking about our public awareness committee, Tina?
Any committee.
So I'll talk about that one just because that's the one that I am the staff person for, and that we have an absolutely wonderful chair of. But it's something that I really enjoy, and I sit on a lot of committees myself, so I know this isn't always the case, but that everyone who is on the committee is not just an ideas person, but a work person too. Of here's what my idea is, here's how I think it can be implemented, and here's what I can do to help you put it in place. And I think that's so important. And I think that having people that in their own work lives are in different areas also helps to make the committee really effective. So, for the public awareness committee, you have your own nonprofit and you're doing a lot of advocacy work. We have people who are on the committee that work in the intellectual and developmental disability field. We have people that work in higher ed. And it's bringing all of these different viewpoints together to make sure that whenever we're putting something in place, whenever we're coming up with ideas, we're really taking everything into account. We're making it as accessible as possible, not just for people with disabilities, but in general, that we're taking into account, are there any language barriers? Are we having things translated correctly? Are we taking into account that maybe not everyone has access to a computer and high-speed internet, so we have paper versions of brochures or flyers that we can hand out? And I think it just really comes together very well, and I think we've been pretty successful so far. So.
Yeah. Oh, I think it's great because what I've seen from the committee is you have physically disabled people, you have blind people, you have deaf people, you have developmentally people, you have everyday normal ableized people, as you want to say, I guess as able as possible. So we're comprised with a very good mix of people that all come together for a common goal. Bob, you've been with the commission for over 40 years now, I believe. We're somewhere in that facility. What have you seen over the years of how people have worked together and the differences of the different types of people that have come and gone?
Well, I would say if you go back to the 1980s, the commission worked with folks with psychiatric impairments to help them get to a position where they could advocate for themselves through advocacy. Rhode Island in the Union to amend its constitution to prohibit discrimination on the basis of disability, whether it was behavioral health, intellectual, physical, medical. So that was probably our biggest early change. And we're still only one of about a half a dozen states that actually has anti-discrimination provision in its constitution, protecting folks with disabilities and ensuring they get the same lousy service everybody else gets.
Well, that's a nice way of putting it. But how did you become 40 years ago to be part of the commission? I had asked the girls that earlier, but I'd like to hear how you started over 40 years ago.
Well, I was working for the State Department of Education in their civil rights office, and in the late 70s, there was a passage legislation, the first federal legislation protecting the rights of people with disabilities in programs that were funded by the federal government. And I became their expert on the new law and regulations. And then there was opening over at the Governor's Commission on Disabilities. I applied, and
the rest is kind of history at that point. Yeah. Because we're nearing the end, Rory, tell us the most important thing that you want people to know about the Governor's Commission on Disability.
Probably the most important thing, I think sometimes we're the best kept secret in the state, but I think the most important thing I'd want all citizens to know is that the Governor's Commission is there for you, for your family member, for whomever needs assistance, to make sure that they get fair and equitable treatment and access to their communities. It's an unwavering commitment the Commission has, and it's what we all believe in passionately, and it's all what we support. And we are continually looking for people to help us with that cause. So we'd love to have more people join some of our committees and become more involved in what we're doing, and to just in general to become more active.
Alyssa, tell us a little bit about the most important thing that you would like people to take from the committee, and also I'd like you to touch base on how the college students, come to be working with the commission as well.
Yeah, so to talk about the college students first, we have a paid internship program that's available throughout the year. We offer about 4 to 5 each semester. In different areas, so employment, architecture, accessibility, voting, communications, so and a couple legislative fellowships. And y'all see me at almost every single job and career fair that the universities have in the fall and in the spring, this year virtually, just going out and talking to people. And for me, I think it's such an important piece of what we do, having students come in, having these new perspectives, these fresh ideas coming in. And I've just been so impressed year after year after year. We work now with a couple of the universities for their experiential education programs. So, students that come in, they have to do a project. They work with us for maybe 8 weeks throughout the semester. We work with Prepare RI now in the summer for their high school internship program. And this is the second year we did it. And again, we were just so impressed with them. And while we tend to get a lot of students that have disabilities, or they have family members that have disabilities, or they're going into healthcare when they graduate, we'll also occasionally get a student who is just interested, is just saying, yeah, I have to do an internship and I want to help people, so I picked your office. And that's always so great, because you want people who are going into finance, who are going into government, who are going into MBA programs, who are going to be out of the healthcare field, to take what they learned and apply it every single day of their career, to say, yes, I can and I can identify with these groups, and I can make sure that what I'm doing isn't going to be harmful for that because I had this experience. So personally, if I just want to say, if you're looking for an internship in the spring and you're looking for one to be paid, please contact me and we'll talk.
Contact us.
And the most important thing I would say, for me, for people to take away, is that the commission is here to help. I think that's kind of why we all joined up in the first place, was that we wanted to help people. We wanted to help advocate for people. We wanted to make the world and the state a bit better. So call us and we'll see what we can do to help you. And it might not be, always an ideal situation, but we'll do the best we can to get you what you're looking for.
It's so true. And I mean, with the internships and everything, it is important because every area of life, you're going to deal with at some point somebody with a disability, whether it's a family member, a customer, a friend, or whatever. So having that knowledge under your belt and having that already embedded in you is something that's only going to help you in the future. Because like I said, no matter what area that you're going to live your life, you are going to encounter somebody with disabilities and somewhere in your path. So being educated and being aware of that and how to help them is better to know now than it is to find out later. Bob, I want to pose the same question to you. What are some of the most important things that you want people to know about the commission?
Well, actually, just going back to what you said, according to the American Council on Life Insurance, 50% of adults will become disabled. So every other person that you know will end up with a disability for a period of time. And a commission is available. As Alyssa mentioned before, we have forums, public forums around the state often, and we want to hear what you think the state needs to change. So then we can work with you and work with other groups to make those changes.
Yeah, I mean, that is so important. The commission is not something to be afraid of. It's not something to think that, because it has government listed to it, we're not a conspiracy. We're not trying to hurt or harm anybody. We're literally looking for everybody out there to speak up and help us help you make Rhode Island more accessible. We may not think of certain things, or we don't know every square inch of Rhode Island. That's why we're counting on Rhode Islanders to speak up and let us know what's out there and what we need to be aware of and what we need to help with and what we need to change. That is so important. And like they said, the commission is here to help. Rory and I are also part of the legislative committee. Rory is a lot more in depth and knowledgeable than I am. But tell them a little bit about what the legislative process is and how we help that, Rory.
There are times when a legislator might seek out our advice or opinion on how better to write a bill, so it is more comprehensive or responsive to people's needs. Bills may be submitted for review, and Bob has an encyclopedic knowledge of Rhode Island laws and legislation, and can usually tell when a bill might bump up against some, requirements or ADA or otherwise that could potentially harm persons with disabilities. And we look at all types of bills that come in from all types of groups, whether it's insurances, medical or otherwise, how people do business in the state, it can be around housing, it can be around anything. And if it touches on possibly affecting a person's life, we have a vested interest in looking at it and making either a contribution to making the bill better, to oppose it, or to support it, and to try to influence the legislators too, to understand more about how the bill helps or hurts persons with disabilities within the state too.
Bob, what are some of the most memorable legislation that got passed that you can remember?
Well, recently we worked on legislation, and really what Alyssa and Rory and you were talking about much earlier, and that is getting in place funding to be able to modify homes so folks don't have to go into a nursing home. I'd say that's probably one of the biggest changes. It was something that the Commission, working with AARP and with multiple sclerosis, were able to get enacted, and we became the second state, the only one, as Alyssa mentioned, that actually gives you the money, reimburses you for 50% of the cost within a month or so of you making the changes. Virginia and Maine are really the only other states that have really got a program going. Those, you have to be wealthy enough you can put out the money and then wait a year before you get anything back.
Yeah, very true. Alyssa, why don't you tell everybody the phone number and how they can get in touch with the Commission, whether they want to help out or they need to contact them for some information or for the hearing board or for any reason. Tell them how they can contact the Commission.
Yep, so our main phone line is 401-462-0100, and then the extensions and the emails for all of the staff are on our website, which is www.gcd.ri.gov. Right now, I am encouraging people as much as possible to send emails. Just, kind of that rotating in and out of the office, trying to stay safe. But we are still available by phone, and we are responding to phone calls. And Barbara Palazzo, who is at our front desk, will always make sure, if you call her, that you get to the right person. And that's how you can get in touch with us.
And all of our meetings are listed on the Secretary of State's website. Lori, can you give us that website so people can find out all of that information?
Secretary of State's website is www.sos.ri.gov, and that's the Secretary of State's website, and we're all listed there as well.
Yeah, so any of the public meetings and everything that we have are all listed on the Secretary of State's website because they are all open meetings. So that's how another way that you can get involved. But you can check out the website, you can send emails, and you can do all of this wonderful stuff. But get involved. You get involved into your state in any level that you want, because any one of these commissions or these committees, most of them are once a month or once every other month, or some are even 3 times a year. So you can be involved as little or as much as you want, or just let us know of something that you see is out of the ordinary or not quite right and you want us to help fix it. Make sure you're reaching out to the Commission. And as always become a red bag carrier. That is something that's very important, especially to people with disabilities. It's carrying all of your medical information on you at all times. And it's non-tech based. That is the thing that is so important. You can grab your red bag by going to www.rampinclusion.com, and you can just click on the red bag and you can order your red bag right from there. I know I have given all of the commissioners a red bag, so they are all red bag carriers at this point. And I just want to thank all of you for joining me tonight and informing everybody in Rhode Island a little bit more about what the commission does and taking away the fear of them calling and contacting the commission. So I want to thank all of you so much for taking time out of your busy schedule and joining us tonight. So we'll see you guys all next week for a very special episode next week. And like I said, if you want, don't just sit there, make a difference and get involved in the Governance Commission on Disability. Thank you guys. Have a great night and happy holidays. Bye guys.
Thank you, Tina. Happy holidays to you
Thank
too.
you.